Thank you for joining today's talk on health, aging, and Alzheimer's disease. Help me. Why do I feel this way? I am Dr. LeShonda Wallace. I have been an advanced practice nurse for approximately 20 years. Currently, I work at Novant Health and as the executive director for Seas of Healing. In both roles, I serve to improve the lives of marginalized populations and promote health equity. So I want to thank the YWCA of the Lower Cape Fear and WHQR for hosting today's discussion. Before we begin the dialogue, we want to offer land acknowledgement. The Lower Cape Fear YWCA serves the people within the Lower Cape Fear region. This land once thrived with life from indigenous peoples known today as the Cape Fear Indians and the Waccamaw Siouan Indian people. We live in established settlements along the Cape Fear River, Lake Waccamaw, and many other established sites in the region. We need to protect and honor the history of these places. Indigenous people are not relics of the past. They are still here, continuing to demonstrate their talents and gifts amidst ongoing colonialism and oppression. They are worth celebrating. We hope our land acknowledgement statement will inspire others to stand with us in solidarity with Native nations. So today's topic, aging and Alzheimer's disease. Help me. Why do I feel this way? Understanding Alzheimer's disease and other topics of dementia is important so we can support those affected individuals with the diagnosis, their families, and caregivers. So we have experts here today in this field that's going to help us understand more. Our panelists today, first is Brooke Vallely of Greenville, North Carolina. She's a native and program manager with the Alzheimer's Association of Eastern North Carolina chapter. In this role, she leverages community partnerships to increase awareness and education of Alzheimer's and other related dementias in 27 eastern and coastal North Carolina counties. She was invited to serve on the New Hanover County Advisory Council to address disparities in hospice and palliative care access among the county's most vulnerable populations, and is the Education Committee Chair of Dementia Partners Coalition, a team of local organizations in New Hanover County, Brunswick County, and Pender counties collaborating to meet the needs of individuals and families living with the challenge of dementia. Thank you for being here, Brooke.
Thank you.
And then we have Ms. Faye Jacobs. Ms. Jacobs is presently employed by Therapeutic Alternative at the Geriatric Adult Mental Health Specialty Team that provides mental health education and training for supervisors and direct care staff of assisted living facilities, family care homes, skilled nursing homes, community agencies, and other community-based and faith-based organizations. Faye is retired from New Hanover County Senior Resource Center, and she was the Wilmington, North Carolina Independent Life Service Director. Thank you for joining us, Ms. Jacobs.
Thank you for inviting me.
Yes, most certainly. So today's topic is about Alzheimer's, but before we dive into that, I would like, and either one of you, Brooke or Ms. Faye, either one of you can define what is considered healthy aging.
Ms. Faye, did you want to take that?
Okay. Healthy aging involves maintaining your physical, your mental, and your social well-being as you get older. It includes regular physical exercise, a balanced diet, staying socially connected and engaging in mental stimulating activities, managing chronic conditions, and regular health checkups also contribute to healthy aging.
It's so funny. While I listen to you say that, that sounds like that's like a full-time job.
That is.
It is, absolutely.
Yeah, and Brooke?
Yeah.
Everything that Miss Faye said, I mean, our hearts and our brains are connected, so what's good for the heart is good for the brain, but you also need to add in those extra pieces like fighting against chronic disease, the social engagement part, the cognitive engagement part as well, too.
Thank you both. So when people think of aging, what are the signs of aging? You know, sometimes we can't tell if someone is growing older or not, but in knowing what those signs are, what are also the things that we don't always welcome that come with aging?
Well, I can answer in the terms of normal aging versus signs for concern. We've got a 10 warning signs of Alzheimer's, and it kind of goes through a couple of things to be aware of. Although Alzheimer's is age is the biggest risk factor, it's not a normal part of aging, of course. So things like being able to retrace your steps. We all kind of pull into the house and it's raining and we have some grocery bags. And as we're trying to run in, we drop our phone. The dog ran out the door. And then by the time we get settled, we're like, where's my phone? And we can retrace our steps. Somebody that's showing some signs of Alzheimer's or maybe some cognitive decline is going to have a lot more trouble being able to retrace their steps and being able to find where they misplaced something.
Yeah, thank you.
Yeah, normal age. This is Faye. Normal aging, you occasionally forget things such as appointments or names, but you remember them later on. You can retrace it. Okay, when you are living with Alzheimer's or other dementias, forgetting information recently learned, asking for the same information repeatedly over and over again, relying on reminders such as notes and devices. And if all of this interferes with your activities of daily living, then there's a reason to be concerned with it. Normal signs of aging could be, just including wrinkles and gray hair and decreased muscle mass or slower metabolism or reduced bone density. But these changes are part of the natural aging process, and they do not necessarily indicate that there's going to be a health problem.
Thank you. Thank you so much for mentioning all of those. So now that we've said it, Alzheimer's, how do we define it? What is it?
This is Brooke. We get asked this question all of the time, and dementia is the umbrella term for some sort of brain or cognitive loss, and Alzheimer's is the most common type. So about 60 to 80% of total cases of dementia are considered Alzheimer's. There are other types like Lewy bodies or frontotemporal lobe dementia has been in the news recently with Bruce Willis and Wendy Williams. And then vascular dementia is really on the rise as well, too. But again, Alzheimer's is the most common type.
I like to say that Alzheimer's, I give this type of analogy about it. Think about a car going down the track or the highway, and this car is a neuron. And the neuron gives information to the brain, all right? But what happens with Alzheimer's, you have something in your brain called amyloid proteins. They clump up. And so the neuron can't get in there to give the information. And there's another protein called tau, T-A-U, and those are strands. And once again, the neuron can't get the information in there to give us to do anything. So that's what really happens is that buildup of amyloid proteins and tau is a progressive neurological disorder that causes memory loss, cognitive decline, and behavior changes. It's the most common cause of dementia affecting millions of people worldwide. It's estimated that maybe 6.9 million Americans aged 65 and older are living with Alzheimer's. About 1 in 9 people aged 65 or older has Alzheimer's. 2/3 of Americans with Alzheimer's are women. Older Black Americans are about twice as likely to get Alzheimer's than whites. So it is prevalent. But one of the reasons it's prevalent is that we are living longer. So we need to work on the quality of life.
Because I heard you, Faye, mention some components of the brain and some changes, and I believe that we're going to get into that, like what vulnerabilities may exist. But when I thought of Alzheimer's and then I thought of dementia, I was not sure if they were the same thing. But what I'm hearing from you, Brooke, is that Alzheimer's is a subcategory of dementia.
Exactly. If you think of dementia almost like infections, and we know there's viral infections, bacterial infections, so there are different subtypes of infections underneath there. And that's kind of a similar way that I describe that. The audience is, I'm by no means an expert in this area at all, and my role is primarily to be in the community, to talk to a church, to talk to a women's group. And so I really try to use some analogies that I think that are everyone can understand. And so I found the infections one seems to be a little helpful when thinking that it's a subcategory.
Thank you. The age, Faye, I heard you mention something about age 65, and we are all aging in this nation. Is there an age that we associate with a diagnosis once it's found for someone to have Alzheimer's?
Well, generally they say 65 and older. And then if it's under 65, they call it early onset Alzheimer's, but all early onset dementia. And again, it goes to the quality of life and not the quantity of life. We're just living longer now. And so therefore, we're finding more of these diseases. You know, young folks, there is a childhood dementia. It is very rare, but rare meaning maybe about 100 children get it, and they don't live any longer than 10 years old. And so the symptoms of it, and where you have poor judgment, where you have visual spatial skills, where you have your language skills are decreasing. Your memory, you can remember what you have, where you were in 1969 with your prom date, but you're having problems remembering what you had for breakfast, you know, those kinds of things. So, yeah, the age, if it's earlier than 65, they call it early onset.
Well, thank you for sharing that information. I was not aware that there was a childhood diagnosis of Alzheimer's. And would those groups of individuals be associated with the Alzheimer's Association as well for services or resources?
Not with such a group so small. The Alzheimer's Association has done a lot of advocacy work in working with Medicare and Medicaid so that those that are diagnosed with those early onset diagnoses can receive some of their benefits earlier, not only in the Medicaid or Medicaid area, but services that would normally only apply for 65 and older.
Thank you. Thank you for letting the community know this. Is it inevitable that everyone that is growing old will have or be affected by dementia?
No, it's not inevitable. Absolutely, we're going to have cognitive decline as we get older. I mean, no, we can probably remember a lot of those details from the prom date in 1965, but we're just not as sharp as we were when we were 18, and that's just a natural part of the aging process. You really want to look for more concerning signs of mild cognitive impairment, which could or could not progress into Alzheimer's.
Yeah.
I did read that North Carolina is ranked the top 10 in nationally for having an aging population of 65 years and older. And by 2025, 1 out of 5 North Carolinians will be 65 or older. So we learn a lot about cardiovascular disease, diabetes, obesity, or arthritis among those that are 65 and older. And Alzheimer's is the 4th leading cause of death for those 65 and older. Is there a correlation between cardiovascular disease, dementia, obesity, or arthritis that make someone vulnerable to Alzheimer's?
This is Brooke. Absolutely, that is correct. In fact, we've recently shared within our public health network those modifiable risk factors, which are exactly what you've defined. And physical inactivity is the number 1 modifiable risk factor across the country, and as well as North Carolina, followed by midlife hypertension and midlife obesity. And of those that are living with Alzheimer's, 56% have hypertension and 37% have diabetes. So they're all connected together as far as that chronic disease part. Every time your heart beats, it feeds your brain. So kind of the natural, if your heart's not at 100%, it's going to equate less to what it's able to provide and nourish in your brain.
I heard you mention physical activity. And Faye, I know that you were at the senior center. Is it difficult for our aging population to remain physically active?
It's not difficult. It's if you want to do it. We say all the time, if you don't use it, you will lose it. And if you continue to have that attitude all during your life, you will have a healthier lifestyle. And that's what we all need. She mentioned, all of the physical and chronic ailments, but behavior, something like loneliness, social isolation, that can be contributed to uh, dementia, i.e., some form of Alzheimer's. This just being by yourself, which as we tend to get older, it occurs. That aging process. We live in such a world where being young is just out here. Everybody wants to do it. And it's like everybody wants to go to heaven, but nobody wants to die to get there, right? So with aging, this is what is happening. We've got to start living healthier, so that we can have a well balanced life. If you have a well balanced life, you have a well balanced mind. Alzheimer's is a brain failure. That's what's happening. The brain is failing. And so we've got to keep all the nutrients in our bodies so that we can maintain the healthy lifestyle.
I heard Brooke mention modifiable risk factors. Modifiable risk factors. You want to talk about that a little bit more for us? What should the community know that they should be keeping in mind now?
Absolutely. Well, Ms. Faye mentioned some of those risk factors like women and our race and our age. We can't change those things. As much as we try to turn back the time on the aging and the wrinkles and the gray hair, that's not something that we can do. So in addition to those, and then family history and genetics, everyone's level of risk of developing Alzheimer's is different. But what you can control are diabetes, hypertension, the physical activity, the social engagement. We saw during COVID how much that impacted us. And so that comes across in many different ways for people. And the younger that you can start, the better. But the biggest modifiable risk factors are not smoking, hypertension, obesity, physical inactivity, also even protecting your head with helmets, formal education. Those are all kind of what we call the healthy habits for your brain.
Yeah. That the small amount of alcohol or other chemical, you need to check that too.
Thank you, Faye.
Mm-hmm.
So is there a test? Or, when should people start exploring whether or not they're being impacted by Alzheimer's? How do they go about that?
Well, I know with Medicare, once you turn 65, the cognitive exam is included in your annual wellness. Now, it may not be that strong. It's kind of the words and the drawing of the clock. But really, you're going to notice the most based off of what you notice and what others notice. I always let people know if they have some concerns about their loved one, just keep a little notebook and jot down what you're seeing or when you're seeing, I didn't hit my car. I didn't do that. And then, oh, well, you did. And they needed some help in remembering that as well, too. Ms. Faye, did you have anything else to add?
Well, there's no single test for Alzheimer's disease. Diagnosis is usually based on, as you mentioned, medical history or cognitive testing or brain imaging and sometimes genetic testing. But your first line of defense is to go to your healthcare professional to actually have a relationship with your doctor, because he knows your history. He or she knows your history. Family members tend to think, and what happens is, well, you're forgetting. Don't you remember? Those who are living with dementia hate that. No, I don't remember, or I wouldn't have asked. So that brings on conflict. So, yeah, I would think that you go to your medical um, healthcare person to help you, and have your loved ones to take you. Gently mention this, because nobody wants to be told, I think you have Alzheimer's. So and we can't be self-diagnosing ourselves. So you hand it over to the health professionals.
I would I would like to add too, the Alzheimer's Association is the world's largest nonprofit funder of research. And while of course we want the cure, we want that white flower which we have at our walks, there are other ways, the prevention, the risk reduction, the diagnostic piece. And recently at the world's largest international conference, we've released some findings about a blood test. Basically, it is a blood test that would be in connection with your primary care physician. Part of the difficulty in getting the diagnosis is, one, our primary care physicians know us well, but they know a little bit about everything. And so really being able to pinpoint into that neurological piece can sometimes be challenging. And if you've got that relationship with them, it's sometimes hard to kind of step back and change that. But this blood test it will be a finger prick test, and it will basically support the physician in using this blood test. Okay, there is a level of risk. It is not going to be, yes, you have it, no, you have it. It's going to aid them in assessing the risk. We all live in Eastern North Carolina. We know how difficult it is to go see a specialty doctor. Yeah. We've got to go to Duke. We're going to have to wait and go to Raleigh or wherever that may be. This will help put you up there faster if you need some more of those brain tests or brain imaging.
I think the baby boomer population, which I am one of, we are trying to defy this aging process. So therefore, we will find a cure for Alzheimer's. It is right around the corner. And I know we've been hearing that, but really it is right around the corner. There's been lots of research now trying to find that cause of Alzheimer's. Right now, the only true way they can find it or diagnosis is through autopsy. And that is when they actually look at the brain and then see the amyloid proteins and the plaques and the tar. And then they can say, yeah, definitely this person has Alzheimer's or Lewy body. I think the problem with Robin Williams is an example of that. When Robin Williams was first diagnosed, they thought he had Alzheimer's. And then they thought, oh, he has Parkinson. But through death, they did an autopsy on him and found these Lewy bodies, it was named after Dr. Lewy. And it's a different type of cell shape they found out that was causing the behavior, the depression, and caused him to commit suicide. So,
and just to be clear, the Lewy bodies, that's a form of dementia. Yes. Not necessarily is different.
Right,
from
Lewy
Alzheimer's.
body,
it falls
Parkinson.
Under that
yes.
umbrella.
Yes. Parkinson is a type of dementia. Most people, they don't think that, but Parkinson, because again, it's a brain failure. The frontal temple, that's the one that Wendy Williams and Bruce Willis has. And that happens in younger, and we say younger because it's before 65. So, it's like it's 80 to 200 types of dementias.
I think that's so remarkable how Wendy Williams and Bruce have used their experience to, to put on display, for everyone to see what they're going through, but to also demonstrate how when support and rallying around the person can protect and be
Absolutely.
supportive.
The stigma is still there. And
Yeah.
that's one of the reasons why we have this conversation. We have this opportunity to talk about it because nobody wants to hear the big A word, just like they don't want to hear the big C word. But the more that we realize that other people are going through it and these big figures that we all look up to, different ages, different genders, different races, it really does help bridge the divide to open up a conversation.
Even us, we at one point it was called senility. Then it was called organic brain syndrome, and then it was called Alzheimer's, and now it's cognitive impairment. But it's the same thing. It's a brain failure. Something is happening to the brain, and we have to figure this out for us to be healthy.
So, Brooke, I heard you mention a finger stick. Is that something that I go to my doctor to ask for, or is this something that they have at health fairs and the Alzheimer's Association will be there offering these screenings? How do people get access?
It's not quite ready yet. It is being tested. It'll be something more along the lines that you get with your primary care physician. It's not going to be just like anything else. Like we've heard things in the news. Okay, there are some drugs that work. That's great, but that doesn't mean you snap your fingers and here in Wilmington area, it's going to be available. There's still the rollout process. Physicians and clinicians have to go through training and understand how to administer it, how to read it. LabCorp and other places have to be able to get the results. So while our CEO says we are realistically 1 to 2 years away from seeing it in doctors' offices.
Yeah, I've read about that, and I have some concerns in that from all of these clinical trials because, well, we all know that Alzheimer's is a significant public health challenge. We know that, but the sample is at times does not lead to us having a complete sample. There are lots of people of color are left out of this sampling, and that's what's wrong with it. I think is that we Black folks really have to get into clinical research because I think the drug was it Leqembi or the first one that was out here. That was why it did not go as well because the sample was too small. And so I'm trying to advocate that we as people of color get into this clinical research. We need to be represented in these trials. You will have access to cutting edge treatment. You will be involved in your community, and then it's very impactful for advocacy. We all need to get in this together. Again, I'm going to go back to, since I am the baby boomer in here, that, we're fighting this thing together and we need to do this, all of us. So, and also one other thing I want to say is to be very careful. I've been looking on the internet, and every time you turn around, they've been saying, we found a cure for this and this Alzheimer's or this dementia. You need to be careful when you look at the internet and research on it. When you see something, you make sure that you get 2 or 3 other agencies or references to back up what they see on this internet.
Well, I'm so grateful that we're having this conversation tonight that's being hosted by the YWCA and WHQR. It's talks like this, talks on health with credible organizations and individuals, that this is where it starts. This is where stigma reduction begins and awareness.
Absolutely.
Happen.
And Miss Faye's spot on with increasing diversity. It's definitely a part of the Alzheimer's Association mission. We do have a website called Trial Match, and it's like Match.com, which is where I met my husband on our first blind date.
Oh.
But you go and you make a profile.
Nice plug.
You go and you make a profile, and you may not ever do anything with it. Mm-hmm. And it's for healthy volunteers. It may be a caregiver study. We're looking at prevention, modifiable risk factors, and you're able to, just like you would on there, kind of click what you will do and what you won't do, and then you'll get an email. Nothing might speak to you, and that's it. But there's all types of research that's going on in that. And there's also the North Carolina Registry for Brain Health, where they concentrate specifically on research studies happening in North Carolina.
So someone can go to the Alzheimer's Association website to get that
Yes.
information.
Trialmatch.org.
Trialmatch.org. Thank you, Brooke. I heard you all mention more than once about family members. I think it was Faye who brought it up. So if a family member have a diagnosis of Alzheimer's, will relatives, children, or siblings, are they prone to develop Alzheimer's also?
There is definitely a correlation with family history and genetics. When I'm doing our community education programs, I talk about family history, and we want you to mainly concentrate on your siblings and your parents. Yes, you still want to factor in aunts and uncles and cousins, but the strongest risk is going to come from that section. When we're talking about genetics, we're talking about risk genes and deterministic genes. Risk genes are incredibly rare for Alzheimer's. Deterministic genes are just like all the other genes that we see in our life. If cardiovascular disease runs in our family or breast cancer, they have identified the biggest gene that they think contributes to that. It's the APOE4 gene, and about 40 to 65% of people with that gene will go on to develop Alzheimer's, but it's not a guarantee. It's like many people that decide to get tested for breast cancer. It will increase your likelihood, but it's not a guarantee.
So when you mention risk genes, those are more learned behaviors, modifiable?
No, those are very, very specific. There are a few families across the world, that are going to develop some type of Alzheimer's and at much earlier ages. We're talking maybe a few dozen families that are affected by this. So it's not something that is, really identified as a big concern for the majority of our community.
Thank you for clarifying that, Brooke. I appreciate that. So COVID-19, right? Many of us experienced loneliness and depression, and during the pandemic, those two things, loneliness and depression, gained a lot of awareness. Is loneliness and depression a norm among older adults, and how does it present itself, or, and what can we do to address it?
Well, for me personally, I would give my mom, who, full disclaimer, she knows I use her for a lot of examples. She does not have Alzheimer's or dementia, but the loneliness. Sometimes after we get off the phone, and she said, "Thanks for talking with me. I know I called you during work, but I appreciated this 15-minute conversation." So I think, like Miss Faye said, we're moving faster. We're doing so much more things, a lot of overcommitting for some people, that we forget those opportunities to connect with our family and our friends and our community. And that's vital for healthy aging.
Yeah, depression and loneliness are not necessarily the normal part of aging, but they are common among older adults. And when you think about it, I remember my mother-in-law, who lived to be 94 years old, and she would say all the time, "I've lost all of my friends." Even her church family, the minister would come every Sunday, come by here and talk to her, but he was a young kid to her, because she had been a member of her church for over 60 years. So there are lots of losses. And again, this goes back to healthy lifestyle. This goes back to keeping yourself involved at all times. These feelings can result from life changes, loss of loved ones, or chronic health conditions. And so it's just important to seek help if these feelings continue to persist. But it's not necessarily a normal part of aging. You can go to the senior center and see some 85 and 90-year-olds who are exercising and doing that karate with the front, whatever it is. Yeah, Tai Chi, because they're doing something, that they are are feeling young, and that's a feeling. That's not necessarily an age. Just keep yourself moving.
The senior centers are a great way to get out of the house and combat that potential depression or loneliness, to be around other people that are your age and have similar interests and so many activities to join from. Or if you just want to hang out and talk with people, there's that too. But it's that interaction piece.
Yeah, it's very important.
We are learning so much on today's topic, aging and Alzheimer's disease. Help me. Why do I feel this way? Another feeling that people have, or symptom that sometimes older adults express, is sleeplessness. Am I saying that right? Yeah. Or insomnia. Some may use that diagnosis. And is this something to be concerned about as a threat as we grow older, or does it mean that as we grow older, we just need less sleep as we age?
We include sleep on our program for healthy living for your brain and body. And the CDC recommends about 7 hours of good quality sleep for adults a night. And some people may need a little less, some people may need a little bit more, but really the goal is to have that quality sleep. If you do have things like insomnia or sleep apnea, it does affect your brain activity and your cognitive function. You can think about maybe you're going to get up really early to catch a flight, and the stress of needing to go to sleep to get there, and you end up not sleeping well. And as you're driving to the airport, you might find yourself, I just went through that light. I wasn't sure if it was red or green. So it impacts our cognitive abilities. It's a really important part. I think that it's very individualist on how much sleep people need. But if we can shoot for around that 7 hours consistent sleep, that's great.
Yeah, as we get older, our sleep pattern does change. We may get more fragmented sleep, or we may wake up earlier, or may have difficulty falling asleep, but we still need at least that 7 hours of sleep. You think of a young baby, who how they behave when they don't get enough sleep. Well, we as adults, we behave almost like that. We get irritable when we don't get enough sleep. We don't think as clearly as when we don't get enough sleep. And our bodies need to rest. It does. It needs to rejuvenate itself. So at least try to get as much sleep, that 7 hours sleep, and that is recommended.
Now, we mentioned being physically active, right? And I know that everyone has different abilities. So as we grow older, is there something that growing older adults need to know about performing exercise and physical activities to avoid injury or, to be safe?
Well, exercise is going to be, with the association, what we think is your number one way to fight against Alzheimer's and dementia. There is so much research that shows exercise is good when you get your heart pumping and the blood flowing and the endorphins that you feel that are after that. Now, are there places where we need to have safety and for your ability? Absolutely. I mean, walking is something that is sort of our most basic one, but for someone with an injury, they may have to look at swimming. So you want to go with what works for your abilities. You have to pick something you like because you won't do it if you don't like it. And then you need to look at some other options as well, too, as community. Do you like to work out with a friend or go for a walk with a friend, or do you like to be by yourself and do your own routine or take a class? So everyone's different in that. But again, the getting moving part, getting your heart pumping and that blood flowing is really incredible.
I'll go back to my statement. If you don't use it, you will lose it. So therefore, yeah, I mean, you can do something while you're sitting down. just go up and down on your toes. That will get your legs going. That'll get the blood going, or just move around, move around. That helps a lot. Again, if you don't use it, you're going to lose it, and you don't want to do that.
So one of the number one questions, is there a treatment for Alzheimer's?
There is not a full treatment yet. There's not a cure. There are treatments that are out there, and what they are doing is it's slowing the progression. It is not designed to cure it. If you can think of, we're equating it in percentages. So, 27% more time in that early stage. So that essentially is, 4 to 6 months on average that you can attend somebody's, your daughter's wedding. You can take a trip. You have time to make some decisions and share that with your family. We are getting closer. Each time it's getting a little closer, but it's not something that we can think of even with cancer, that we know you might get chemo and you might have holistic treatments and you might have surgery. And that's really, according to our CEO and the research and scientists that we have at the association, how they see it going. It's not going to be a single pill or cure or a one-time thing. It's going to be similar to cancer in that everybody's treatment is going to look a little bit different, and that you're going to have to go through different options as far as if surgery works for one person and if slowing the risk works for another. So right now the treatments that are out there, they are, one, they're very expensive. Two, they're intravenously. So 3, then you have to find a location that is actually doing, providing that service or that IV therapy, and then to be able to get there. For those that are able to do that, the results are very promising, but it's not something that's really going to be able to serve all of our communities reasonably right now.
So at this point, it's not equitable. I was going to ask you, is it safe and is it effective?
So, and some of the newer drugs like lecanemab, that's the newest one that's out there. They have made improvements from this drug compared to lecanemab that Ms. Faye was mentioning, where some of the side effects that were in there were basically some brain bleeds for essential purposes for that and the buildup. So this one has improved and removed that, and I don't know all of the details, but you can definitely read about it. So each time it's getting a little better. And really, compared to where we were even 5 years ago or 10 years ago, there's still some actual hope, because we have to learn how to crawl before we walk, before we run. So each little improvement is getting us closer to being able to hopefully get to a cure.
I agree with Brooke. There is no cure for it right now, but as I stated before, we're fighting really hard to get to the point, and we are closer than we ever have been. Medication can temporarily improve the symptoms of it. It can slow it down some, but and supportive care is important for maintaining the quality of life. So we just got to keep on pushing until we get to that cure. But we're so close to it. I feel it.
So what I'm hearing is no cure. We can do prevention. We can slow it down. And supportive care is important. So what is brain health? I hear the term or the phrase brain health often. What is that?
And this is my opinion, but I think that we have come up with a way to make it softer and more acceptable to talk about. So brain health is all of those things that Ms. Faye mentioned, the social, the physical, the cognitive, the nutrition. That's all of it. Everything that we do for our hearts and our bodies and minds and spirits go to protecting our brain. But people don't want to talk about Alzheimer's. They don't want to talk about cognitive health or impairment. Those don't seem very relatable. So brain health is really how we're just talking about all of those things together.
So it's encompassing.
Yes, ma'am.
The whole. Okay.
That's just another part of the Alzheimer's or dementia journey, trying to figure out what to do. That's just another component of it. Just be healthy, all of the lifestyle.
I don't know why I thought it had something to do with learning new things, because I was going to ask can older adults learn new things? Is that a
Absolutely.
part of brain?
Absolutely.
Is that a part of brain health? Tell me about that, because I know people talk about doing crossword puzzles, taking on new hobbies. Is that a preventive?
Teaching my mom how to use her iPhone. I mean, those are all new skills
Yeah.
Good
that
one.
we're
We
learning.
still can learn. I can say this because I'm 75 years old. We still can learn. We just learn at a slower pace. You know, you can, we want to learn, and the learning process is just slower. The ability to acquire new skills and knowledge continues throughout life. Just give us the chance. Be patient with us. I think that life is an ageless classroom. You continue to learn every day. You have to.
There's a lot of research on formal education, and this doesn't necessarily mean, going back and getting another degree or completing your master's. This is that type of classroom environment. So it can be taking a floral design class at a community college, signing up for a Bible study at your church. Anything where you're going and seeking out new information is considered that formal education. And then the challenging part for yourself. So you mentioned crossword puzzles. I can do people crossword puzzles, but if I try to do the New York Times crossword puzzle, I feel very challenged in that. But you want to look for those opportunities to take something that you know and that you like and learn more about it and do more with it.
Yeah, like those word searches that you see lots of older adults doing that, and it's multiple. You're using your motor dexterity by doing the circle, to do that, and then your brain by recognizing the words. So it's all of this in just we all are trying to get to that point where we can remember all of these things. So everything is going together.
I see a lot of advertisements about supplements to help with cognitive decline. Do they work? What are they?
Well, at the association, we support the WHO, the World Health Organization statement that there is no supplement, vitamin, food that will cure or prevent Alzheimer's. And this part is just my personal opinion. If there was, it wouldn't be $75 a bottle. It would probably be a lot more expensive. Those studies, when you get those bottles, if you look at the teeny tiny print that I have to hold out here and get the magnifying glass, the FDA has not approved those statements. They don't share their research with the public, as in some of the larger quality nonprofits and researchers. They have to go through that vigorous study, randomization, has to be peer reviewed. If it says 50% of people lost 10 pounds, we don't know how many people that is. We don't know if they just lost 10 pounds to go to their 25-year high school reunion, and if they did anything else, if they ate better and drank more water and exercised. So without knowing the full big picture of those studies, we support that organization in saying that there's no one supplement that will do that. But absolutely talk to your primary care physician. If he recommends anything, they're going to be your number one advocate and know you best.
Yeah, I agree with what Brooke is saying, and be very careful about these products and these studies that they say, that these clinical trials they say that they do. You have to remember that each country has its own FDA, okay, for lack of any other term. And ours in the United States is much stricter than those in some other countries. And so what may have passed over in Britain or over in some other country may not, and usually does not, pass the standards here in the United States. So some of these supplements pass other countries' rules, but now not our rules and regulations. But you see them on television, so they may even have side effects or interact with other medications. You have to be really careful when you start taking supplements. Make sure that you talk with your health provider.
Thank you. Thank you, Faye.
Mm-hmm.
What are the greatest threats to our aging population, and how can we counteract them?
Hmm.
Me personally, I think two pieces. One, the workforce. We're living longer, like Miss Faye said. Who's going to take care of us? The direct worker staff there's such a huge turnover. If you need home health or home care agencies or getting some of those supportive services, if we think about neurology, there's not a lot of even coming out of medical school that are choosing to specialize, maybe neurology in, the Grey's Anatomy or curing Parkinson's type way, but not in neurology, gerontology, things like that. And then honestly, I think the other cost is the financial piece. It is very expensive to get old. If we think about all the additional services, for example, the national average for home health is $33 an hour. We're looking at $300 a day to be able to go into certain types of assisted living. So it's not something that we can readily afford, I think, as we look forward towards retirement. If we need to be able to age in place, we might need some of those additional support services so that we can do that.
I deal with behavior, and I think the lack of empathy, that we are so into the youth, the Gen X, Y, Zs, the
Millenniums.
yeah, that we are forgetting our older adult population. And until we can come back, and I never thought that we would have to teach empathy. When I grew up, you saw it by example, But now I go and talk to CNAs. You really have to teach them, and I don't know if you can, empathy, not sympathy, because sympathy is saying, "Oh, I feel sorry for you," or "I'm so glad you have that," and I don't, But empathy is that you're going along that journey with them. You can identify with the problems that we are having. Until we can get to that, I strongly believe that by coming together as a collective force, we can make a meaningful impact in fighting this Alzheimer's and dementia disease.
Thank you. So, Brooke, tell us, what resources do the Alzheimer's Association and your partners have for those families?
Absolutely. I'll share two very quickly. At the Alzheimer's Association, we have a 24/7 helpline, and you get to speak to an actual person. There's no robot. There's no press 1 or 0. So it's master's level clinicians, counselors, social workers, and we can translate and work in multiple languages or closed caption options. So if it's, Alzheimer's doesn't have a timeline. If it's 3 a.m. on Christmas Eve, and you've got to be able to call, you can call and talk to somebody. So having that ability to ask a question about, is this behavior normal? Or I'm seeing these signs, but my mom won't go to the doctor. Do you have any tips? Any of those things are great. And here locally, we collaborate with Lower Cape Fear, their Life Care Memory Partners, and the Cape Fear Area Agency on Aging for Caregiver Academy. Basically, it is the three of us coming together and saying, we do things that are similar, we do some things that are different, but we're here to provide education and resources. So we've work collaboratively and have a website. We share our events and our flyers. But if you go to memorypartners.org, you can learn more about that.
Thank you. Ms. Faye, can you tell us about the therapeutic alternative? What resources and how are we supporting the community?
By educating our public about mental health issues, about Alzheimer's and the other dementias. We encourage you to learn more about it. We encourage you to plan how to care for someone that is living with Alzheimer's disease, create a safe home. We want you to learn more about the medicines that person may have to take, and then respect. That is still a human being there. They're still in there. They may not be able to recognize you, but they will be able to recognize the feeling that you once gave them. So that's what we try to do, is to educate.
Thank you so much. Today's topic, aging and Alzheimer's disease. Help me. Why do I feel this way? Thank you, Brooke Vallely. Thank you, Ms. Faye Jacobs, for joining us and having this healthy conversation on healthy aging, as well as learning more about Alzheimer's disease and dementia.
Thank you. And thank you, Brooke, for sharing your information with us.
And thank you, Miss Faye. Absolutely.
On behalf of the YWCA of the Lower Cape Fear and WHQR, thank you for joining us today, and hopefully you will attend another topic on Talk on Health. And we'll see you again soon.